Hello everyone, hope you're doing well. Welcome to Exam 1 Check-In. So Exam 1 Check-In, I think you're going to really enjoy this exam. I know exams can be stressful, but this is only 40 questions, true or false, multiple choice, and short answer, and it has directly to do, of course, with the textbook and then with material we've already studied. So this is a study guide for you to use in order for you to concentrate on exactly what to study. You have to use Lockdown Browser. There's going to be a little more information in the announcement section about Lockdown Browser, how to use it. The considerations for this exam are you can't open another window at the same time. That's why we have Lockdown Browser. You can use Open Book, which is a good thing. However, once you open the test to start, you have to finish it. So it's not something you can come back to. So let's review these questions from the perspective of the things I want you to study on. They're going to be similar, but they're not going to be the same as the questions on the exam. They're going to be similar concepts. So write these down. And I think if you know these concepts well, then you're going to do good on the exam. Utilitarianism. What is that? What is utilitarianism? Know about HIPAA? What is HIPAA? All right. Know about, how about when consent forms are needed? When does a patient sign a consent form, right? Know about rights-based ethics, duty-based ethics, and justice-based ethics. How about evidence? What is evidence used for in a civil lawsuit? What is a civil lawsuit? What is evidence in a civil lawsuit? Know about the Joint Commission. We've talked about the Joint Commission a little bit. What is a Joint Commission? What does it do? Know about the doctrine of informed consent. The doctrine of informed consent. How about autonomy, non-malfeasance, beneficence, and paternalism? Know about those. What are statutes? What are they meant for? Where do they come from? What are statutes when we talk about the government? How about the doctrine of respondeat superior? What is the doctrine of respondeat superior? We've talked a lot about the standard of care. What is the standard of care? Contract law. What is contract law? What is tort law? Maybe even constitutional law. What are those things? We've already talked about ethics. There's a couple of questions about rights-based, justice-based, all those ethical standpoints, right? All right. We talked about JACO. Make sure you know what JACO is. And the acronym, of course, is JCAHO. All right, know about the basics of healthcare. Why do we deliver healthcare? It's, of course, to deliver the best care we can to patients in need, right? Make sure you know about that. It's also important to know about the basics of the federal government, from the executive, legislative, judicial branches. Know about those things. Know what an agent is. So when you're acting for a patient, endurable power of attorney. What is an agent? We've talked about negligence, right? There's a couple questions on negligence. We've talked about beneficence, non-malfeasance, autonomy. I know I've mentioned that before, but there's a few questions on that. All right. How about fraud? What is fraud? You hear that term a lot in society today. What is fraud? A couple of true or false questions. Most of are similar to what we've already talked about. What is a living will? Make sure you know what a living will is. You know, who applies ethical standards to practicing healthcare delivery? We've talked about that a lot. JACO is a professional organization. They do apply ethical standards for healthcare delivery, so keep that under consideration. We've talked about implied consent, informed consent. What is implied and informed consent? All right, a couple more that I want you to be aware of. The Good Samaritan Law. What is the Good Samaritan Law? What is an expert witness in a case, a healthcare case? An expert witness. And that is pretty much it. So I ended on expert witness there. You do have two short answers, only two. And I'm not going to give you kind of what those are about, but we've already talked about those and what you should go over. So if you go over all the questions or all the things I said you should know in this exam, and you study those, write them down, you're going to do quite well. But overall, like I said, 40 questions, multiple choice, true or false, a couple short answer. You got to finish the test in one sitting. It's going to have a 2-hour block to finish the test, and it has to be done through Lockdown Browser. If you have any questions, don't hesitate to reach out. It's not due till June 11th, so take your time, study the material, and I think you're all going to do great because we had a great group this cohort, and I think you've really studied and you're going to know the material quite well. Reach out if you need anything. I'm looking forward to some awesome test grades. Thanks so much.